Welcome back to BT here on City. We are joined again by Dr. Zach Levine from the MUHC, and today talking about medications. And this is a big one, Dr. Zach. First of all, let's talk about medication. I imagine, as we age, I imagine we start taking more and more medications.
Oh, yeah.
The stats, I was looking over 75, on average, 6 medications?
Yeah.
Which leads me to ask a question. I don't know if you can answer this, but are we over-prescribing medications in our healthcare system?
Well, potentially.
Okay.
I mean, it's hard to say, because I'm not a big medication person, but some medications are absolutely necessary,
Of course.
and they're life-saving. Now, are we prescribing too many? Maybe. And also, are we prescribing medications at cross purposes? That's another problem, right? If you have multiple doctors and you don't have one sort of centralized doctor and you don't have one centralized pharmacy, then you can have medications that actually that are working against each other. So it's not only the side effects, because all medications have some side effects.
Of course.
But then if you have one medication that's, for example, increasing your blood pressure and the other one is decreasing your blood pressure as a side effect, then basically you're getting no benefit
whatsoever
from the first one.
Well, I mean, that's probably your first piece of advice, is go see the same doctor, go to the same pharmacy, so that they have all the information that they can share with you as well each and every time, right?
Absolutely. If you have a centralized, and the thing that I was mentioning earlier is, side effects and interactions between medications. There's millions, right? So no one person can remember them all. And so that what the pharmacy has and what Health Canada has are they have huge databases and computer programs that automatically, when you get 2 medications together, they automatically have a red flag that says, okay, these 2 medications interact with each other, you should really be careful, this sort of thing.
Right.
And so, yes, having one centralized place, one centralized person, a doctor, a pharmacist who knows, that can certainly save you a lot of problems.
Now, we say, mixing medications, different medications, but what about, other things that we ingest, right? The foods that we eat, can that have adverse effects as well with medication?
Absolutely. So I think a lot of people don't think of that. We know about medication interactions, but medications interact with lots of different things, and certainly diseases. Like, so if you have a lot of medications, for example, are broken down or metabolized by the liver or by the kidney. So if your kidney's not working well, for example, you should not be on the same dose of antibiotics is a classic one. So we always, if you have kidney disease, you should be on a lower dose of antibiotic because it's not going to be broken down as quickly, and so effectively you're getting a higher dose. And so you can end up with, if your kidneys are not working properly, you can end up with a toxic dose, even if you have, the regular dose for most of us. So you just have to watch that. And as an emerge doc, it's one of the most common reasons when and this is a Canadian study, one of the most common reasons that people come to the emergency department is either drug interactions or drug side effects.
Really?
It's quite amazing, yeah. So
I didn't realize it
if
was
someone
that
comes
common.
in with like lightheadedness, dizziness, one of the first things we look at is, do they have a slow heart rate? Do they have a low blood pressure? And then if they do, definitely one of the most common reasons for that is their medications, because we give a lot of people medications to decrease their heart rate and their blood pressure, and sometimes we overshoot.
And some people, ignore some of the warnings, right? They get that prescription, and on it may say, don't take alcohol with it, and people do. Is there a real adverse effect of alcohol? Let's talk antibiotics. You just mentioned it. Can that have a big effect on your system?
It's a classic question. A lot of people, when I prescribe antibiotics, they're like, oh, so I can't drink for the next week or whatever.
And it's that terrible, right, for 1 week.
I hate to say yes, you can drink, it's no problem. Because, so I'm always like, well, you can drink in moderation. The truth is, most antibiotics, it's actually safe to drink in moderation. I never encourage people to binge drink. There's a couple of antibiotics, however. Rifampin is a classic one. Sorry, rifampin is for another thing. Metronidazole, which is also known as Flagyl.
Okay.
And that one, if you drink alcohol with that, you're going to get very, very sick. In fact, it's used to stop people from drinking. But the truth is, most antibiotics are actually okay. You can drink moderately. Having said that, if on your list of information from the pharmacy, it says don't drink alcohol, then don't drink alcohol.
Right.
Yeah.
What kind of questions should you be asking about your medication, both to your doctor and even your pharmacist?
Yeah, I think it's never a bad idea to question authority, just, respectfully.
Of course.
So why do I need this medication? So, yeah, is it really necessary? What's it doing? Is it interacting with anything that I'm eating, any disease process I have, any other medication that I have? What can I expect in terms of side effects? And then another thing that's important is what can I expect in terms of recovery? That's one of the things I like to tell people. So, we're starting on this antibiotic. Within 24 hours, I really expect you to have a significant improvement. If there's none, come back to the emergency department or go see your family doctor.
Right.
You know, what to expect. Because sometimes it takes a couple of days to work. So if that's the case, that's fine. But if it really should be working right away and you're getting worse, then you should be representing.
And should you finish all of your medication? You know, some people start feeling better, like, oh, you know what, I only have 3 pills left, I feel fine, and stop taking it.
You're right. That's a great question, and it's not necessary for all medications. For antibiotics, yes.
Okay.
And the reason is, even if you feel better, you may still have some of that bacteria left, and it can actually breed resistance. If you have a little bit of bacteria left in your system, you don't finish your antibiotics, the bacteria can kind of get stronger.
Right.
And can actually come back. So you really want to finish antibiotics. On the other hand, a pain medication, for example, usually those you don't have to finish. I tell
Right.
people that, take it as long as you need it, but as soon as you're feeling better, this is just to treat the symptom. It's just symptomatic treatment. As soon as you don't need it, stop taking it.
Great advice as usual, Dr. Zach.
Thank you.
Always a pleasure having you. There's a lot of more information, by the way, that we could have shared. You can visit our website, btmontreal.ca. Click on the blog section for more information.